just talk.
That's it. Talk politics.
Yeah, news and current events and everything that's transpired over the week. And what a crazy week it's been. Let's go ahead and introduce our panel. Pretty diverse and interesting panel this morning. This is a guy who I grew up reading the hiking book. I think we all did. And I just really love, I don't know if I want to call it an evolution, Dave, but I just love how you're very vocal and, you're critical, and I like how you put your perspective out there. Dave Lotz is on our panel this morning. Good morning, Dave.
Well, thank you. Thank you for the great endorsement.
Right. Now, the thing behind Dave, kids, those are called books, all right, in case
you don't know.
Yeah, and then over... I feel like we're watching Brady Bunch. On the upper right-hand corner, we have this guy has been very critical of the governor's COVID-19 response. Dr. Tom Shieh. Good morning, Doc.
Morning. How are you?
We're doing very good. Thanks for joining us. And then we'll go to the bottom corner from the Cannabis Control Board, Will Parkinson. Good morning, Will.
Morning, everyone. How is it?
We're doing pretty good. And
wake and bake? Is it a wake and bake kind of day?
Of course it is. Every day, right, Will?
Friday.
It's Friday.
Like the way
you ain't got stuff to do. And then we're bringing back Moneka DeOro, who, of course, is with Micronesian Climate Change and just a whole bunch of cool groups. Good morning, Moneka.
Viva Betness.
There you go, Betness. We're just gonna go
every Friday.
We're just gonna go round robin, and we'll go ahead and start with you, Moneka. Ladies first. Hope you don't have a problem with that. Just what are your thoughts on the surge, the governor, the lieutenant governor, COVID positive, the closures, just where we're at this morning as we're waiting for this announcement to come out about which P-Corps we're going to be living under for the next 2 weeks? What is Moneka DeOro thinking about all of this morning?
Definitely, as a parent of a GDOE student who was going to be attending Onslaught Middle School, and as a former teacher, I'm so relieved that the schools are not going to be opening for face-to-face learning. My son was signed up for face-to-face, and it was interesting to find out that only 40% of the students, or even less, were going to be attending face-to-face. So I felt a little bit safer knowing that he would only be in a class with 8 to 10 students, and but even with face-to-face, he would only be in school 2 times a week at most, 5 times a month, 5 times throughout the month. Right. So I feel like moving to the online space, and I didn't know that until this informational that they had the other day. So moving to an online, to the online space where he'll be learning every day is something that I think I'm going to be doing. And it seems like everyone else probably won't have much of a choice but to be going to that. So I'm relieved. And then in regards to the positive cases, especially from our leaders, I definitely met with everybody else in the island and praying for their speedy recovery. And it just is all the more real. It just becomes all the more real because I didn't know anyone personally for the longest time who was a positive case. So now that there's all these people who I do know, it's so much more real to me, this whole pandemic.
Mm-hmm.
Will?
Yeah, the first thing that I thought about when we're talking about going back into shutdown is, I mean, it's kind of tragic because I'm not surprised. We all knew a second wave was going to come, especially with the opening of the schools. And really, like, I hope we decide to close the schools for longer rather than for shorter, because we could either do this now or we could do this longer. And I prefer to do it now and not do this longer.
Dr. Shieh, this could take a while.
Do you really want my opinion?
Oh, yes, we do.
No, we brought you on here to talk about puppies and rainbows.
Tell us how you really feel.
This show is called The After Party?
Yeah.
I guess I missed the party.
Yeah.
Anyway, I think I've been very vocal, not just in the media, but, outside of our comfort zone for a lot of people. But I think from the very start, I said wear a mask, and that was way back in February when people were saying that you don't need to wear a mask. Even the CDC was sort of against wearing a mask at that time. And, I don't know, I have nothing else to do when you're at home by yourself, and drawing cartoons. So I'm sure you saw some of my cartoons. And the latest one that I pushed up again was that a dog chasing his tail, right? So we are going round and round, a dog is chasing his tail. And the reason I put that up is because we keep testing, but what are we doing with the positives? Certainly you're going to have people who is symptomatic, and a majority of the people is asymptomatic, which means they don't show any symptoms. So we're testing them. So if one of them becomes positive and they're being asymptomatic or no symptoms for over 4 weeks, we're still locking them up for 14 days. And I sort of disagree with that, because we need to look into it further. We need to be smarter and test smarter. And if they have no symptoms for 4 weeks, test their antibodies. How do you think the vaccine is going to work? You get a vaccine, and if you're exposed to the virus, it's a similar situation. You're going to develop antibodies. So if you have antibodies in your blood and you've been asymptomatic for 4 weeks, that tells you that you've been exposed and you developed antibodies. It does not mean that you're immune, because we're not looking for immunity. We're looking for a past infection. So if you had a past infection, more than likely you're not going to be infectious after 4 weeks. If you think about it, you're locking people up for only 2 weeks. So I'm saying 4 weeks is a good leeway to test for the antibodies. And a perfect example recently, as you said on your show, the governor, lieutenant governor, Dr. They all tested when they were asymptomatic. And when they're asymptomatic, they were negative. When they developed symptoms, what happened?
Yeah.
The test came positive, right? So that will tell you that you're going to test all these asymptomatics. More than likely, they're going to be negative. And if they are positive and they're over 4 weeks, I would test for the antibodies. That way you don't keep chasing your tail. Right. Because we're going to keep counting positive, keep counting positive, we're going to keep adding up. And it's not just Guam, it's with other states as well. Right. So I think we got to be smarter, because when you get the vaccine, how do they test if the vaccine is effective? They test the vaccine effective if you develop antibodies. So I think we need to move on and really look at that.
So we're about to have this massive community testing or restart it. Are you saying that we really shouldn't be going that direction and having all of these mass testing, which starts tomorrow actually in Jigo?
I think you should save the reagents, because what I've heard, there have been delays and the reagents are short. If you're going to start using up all your ammunition, you're going to use up all your resources and testing all these asymptomatic people. Majority of the asymptomatic is going to be negative. Right. So what happens is that, like I said, a perfect example, governor, lieutenant governor, Dr. When they're asymptomatic, they test a negative. When they turn symptoms, they test a positive. So don't you want to save some of your ammunition to test those people who's actually symptomatic? Right. Dave? So those are things that I need to at least to get across. Right. There's differences of opinions on how you approach this, but we're not getting others. We're still chasing our own tails, and that's a problem. We need to think out of the box.
Dave, what are your thoughts, Dave?
I've got a question, Dr. Shieh. If getting reagents is not an issue, is testing a good idea? If getting the reagents would not be an issue?
Well, testing is always a good idea, but I think you have to do, what do you do with a test, right? Like I said, you need to dissect out the test. Let's say if you're my patient and you tested positive for a certain disease, and I'm going to say, let's take a look at this. Have you seen the result? Well, have you seen the report of actual positive COVID test? Let's say you get a report from DLS or from the public health. They'll give you a report.
Actually, no, the lieutenant governor is the first person I knew that I personally knew that had the
report.
COVID. No, the actual COVID.
The actual report, not just
I've never seen the actual report.
Okay, I would encourage each and one of you to get a copy of that particular report, and then read below that report. There's a disclaimer under every report that's positive, and the positive will say that you may test positive for COVID. However, there may be other bacterial infections or other viruses that could be the cause of your symptoms. And that is on every single report of COVID positive patients. Every single report that's there.
Okay, Dave, let's take it over to you. Your thoughts. Go ahead.
Well, thank you, and I appreciate the insight from Dr. Shieh, and certainly we're all suddenly very concerned again, and I think it's important that we take efforts to prevent this spread. I do think the people on Guam are much better than as a whole as in the mainland. In the mainland, this has been very unfortunately politicalized. Yeah. And that was completely needless. This is a public health concern, and we should listen to our public health experts. At the same time, I think we're still learning about this virus. I don't think we know all the ins and outs about it. Some things that come up that maybe need to be answered. One is the flight that came in from Honolulu. Were all those people tested prior to the flight? I don't know. I don't know if anybody in this group knows, but I think they all should be tested before they got on the flight. And the eventuality was they were all quarantined. The other thing is you had two individuals very knowledgeable on before dealing with the election and the police. It's the realization that other things go on in the community that basically do not have to stop.
Right.
Certainly the election, certainly we have crime doesn't stop, unfortunately. And then, you know, I've been vocal on the military buildup. That hasn't stopped because of the virus. And we had a little bit of coverage on the programmatic agreement the other week that just as an indication that these things continue. And I just hope that we will continue to have continual coverage on broader aspects of what's happening in the community.
Right. You know, the way I look at it, guys, and we were talking about this yesterday, Bree, is the first time we went through this lockdown, I mean, if we are looking at a lockdown, it was just so foreign to us. There were just so many things that we had on our plate, you know, mentally and physically, all of it, right? And it was new territory. The way I'm really trying to just make sense of how we're going to move forward, or at least me, is the way I'm looking at it is we've been here before, right? And so we really got to take everything that we learned during that first lockdown and bring it with us into this new wilderness that we're heading into so that we're not completely lost. I mean, and I think that's key. We've been through this before. Let's look at what we did the first time and maybe readjust it and, you know, let that be the way that, you know, we kind of move through PCOR 2 or PCOR 1 or whatever PCOR it is that we're going to face. I want to kind of switch gears a little bit here, and I have to ask you guys about this. You know, and to me, it's not even that she said bitch, right? It was just that it's one of those moments where, for whatever reason, it resonated with so many people because in trying to make sense of this COVID, a lot of times you can't, and what you just think is like, it is a bitch. Mm-hmm. There's just nothing else to say about it. So let's just run through you guys. What were your thoughts about that? You know, the governor saying the virus is a bitch, and Lana, it knocks you. It knocks you, Moneka. Daya? Go ahead, Moneka. What was your take on that? Because it was kind of like, whoa.
I think you touched on some really important points, Chris, about like going back to the way that we were taking the precautions. And for me, and from the perspective of climate change and doing climate change awareness work, I really appreciated how more people were experimenting in the home, experimenting with home gardening, tending more to their families and not traveling. So those things are I hope that we continue to build those practices, especially when it comes to wanting our island to be more food secure, also like increasing your gut health and really taking care of your mental health is really important. And you can do those things through paying closer attention to your diet and being healthier and making healthier choices. And with COVID going around, it's really important and that we do things that increase our immunity, like exercising and just trying to maintain our stress levels. And gardening is a great way to kind of handle that. So I appreciated those sort of shifts that were happening at the onset of COVID, and I hope that we continue to build those practices and those healthy habits. With regards to the governor using a slur or bitch, she's definitely gone viral with it, and I don't know if that was her intent. It's never really intent for anyone to go viral.
Right.
But it is resonating with people. I've seen so many people repost that. So I think it's hilarious, and I think she was just her being real and keeping it real, and I appreciated that.
Well,
yeah,
I know you know something about gardening.
But yeah, I do think the moment with the governor was a very humanizing moment for her. I know there have been a lot of people that have been cross with the governor, and I really think that this kind of brought everything kind of home. She took one for the company. She's got COVID right now, and I think that's really bought her a lot of goodwill. And hopefully we can go into this next round of lockdowns, if that's what we're going to, with that goodwill to maintain the discipline that we have as a collective island. Because someone mentioned, I believe it was Mr. Lotz mentioned it, that we are much better off, for as bad as things look on Guam, we are much better off than we are in the States. And, I really got to credit that to an Alpha Malik spirit here on Guam. We all grew up and were raised on Guam that we're all here to take care of each other. And it really shows in the way that the island came together and really showed what they were made of. I was very proud of that. And I hope we can maintain that sort of discipline again.
I'm going to go to Dave. Dave
I
first.
like that little bit of what Moneka was saying, because what she's saying resonates, that we need to come out of this and look a bit more at how we can be more self-sufficient. And when they talk about getting back to what is called normal, do we really want to go back to what we thought was normal? And can we take some lessons out of this and move forward? And to me, one can't be truly self-sufficient, but I think we can do more to raise our own food, and our food should be healthier than all the stuff we bring in. And that translates into other aspects, like how we look at future land use. But I think there are a lot of lessons to be learned that we need to apply, and perhaps have some sort of forum to looking to the future instead of looking to the past.
Mm-hmm.
Do you guys
Dr.
think
Shieh?
that this is a temporary change? Because right now our economy is 60%, 70% consumer spending. So do you think COVID is going to encourage structural changes where we have new industries and maybe less of our GDP becomes consumer spending? Or is this the sort of thing that as soon as COVID gets handled, whether it be in 6 months or in 3 years, do we go right back to our consumer culture, where most of our spending is on things we do not need?
Dr. Shieh, would you like to chime in?
Well, let me, I've been waiting to address Dave's question regarding the flight. I do know that not everybody on the flight was tested before they arrived in Guam. But I do know that the military person did test prior to arrival, but prior to arrival, he did not wait for his test results. And, that's a mistake. And that's a discipline of the military. And as a former naval officer myself, I would discipline the person who did that. And that's uncalled for. And that placed the entire flight at risk. Now, going back to Dave's question regarding the flight, that leads to my other comments that I've said before, that we need to stop playing with formulas regarding high risk, low risk territories or areas flying in. Every passenger that get on the same airplanes, we know as soon as somebody from New York gets in, or California, Florida, sits in the same cabin that flies for 7 hours or 10 hours or 12 hours, everybody in the airplane is going to be at the same risk level no matter what you do. Perfect example, they quarantine the entire plane. We don't know the whole plane, but if one positive, the entire plane's quarantined. Why do that if somebody came from a low risk area? So, that said in itself, that I think we need to stop saying low risk, high risk, and base everybody who's arriving passenger, no matter where they come from, treat them the same way. And I don't agree with government quarantines, because we're all adults, and I think we need to be able to go back to our homes, especially for our local residents that's coming back, especially if they went offline for medical treatments. You don't lock them up in a hotel and expect them to be self-sufficient by themselves. I think when they come back, and have patients who went to Hawaii or Los Angeles that came back for medical care, and when they come back, they're in the hotel and they're locked up there. And we need to try to get our residents back home so they can be with families. And if we're worried about them roaming around, then we need to come up with a better way of monitoring them. Contact tracing is good, but I think that they're adults and they're coming home. I think they should be able to go back to their own homes. Now, regarding the governor's B word, I really don't have any comment on that, because I think all viruses are bad. I don't think there's a good virus. But I think getting to the seriousness of this entire thing, we really need to get out of this spin. Regarding Will's question regarding the economy, I don't think the economy will recover for a while. However, the government had projected our economy to be in pretty good state. I think she said we're going to have about 800 million in revenue in 2021. So if that's true, I don't think we're going to have any problems being self-sufficient in the financial aspect of it. But it could just be Guam. But you see the private sectors, and Pika Restaurant is one of my favorite restaurants, and they're closed. So I'm kind of disappointed at the private businesses are shutting down.
Right.
But regarding Monique's idea about gardening, I love gardening, but I just don't have a green thumb. You know, if I plant something, it probably won't grow. So I'm a consumer that I go out to pay less, and I just get my fresh vegetables as much as I can. And I think Friday is where they come in. So as much as I can, I try to do what I can to support the economy myself. So I think all in all, we need to get out of this spin. If not, we're going to keep spinning. You have one lockdown, a month later, you're going to have a surge in cases. But again, to get out of this spin, you're going to have to test. Be smart in what we do and dissect out who's really positive and who's really infectious. Not everybody who's positive are infectious. That's my comment.
But Doc, considering that
let
we've
me
seen
ask
these
the doctor
cases,
let me ask the doctor one thing, because there was an individual who came in on a flight and was put into quarantine and then subsequently died.
Yes.
Now, I think that's very troubling, and I'm just, I hope lessons are learned, and I hope people are held accountable.
Right.
Yeah, I agree. I think that's part of the issue that, people coming off from off island. I think that person came from off island for healthcare reasons and coming back home. So he had a pre-existing condition. Those people, our island residents, should be able to go home so that we can take care of them ourselves. They can't be self-sufficient. They can't be stuck in a hotel room. If they have a heart attack, how do they call 911? We have to constantly monitor them. Guam is a very friendly atmosphere, very compassionate. At GMH, I worked in GMH for 23 years. Next week, I'll be in Guam for 24 years. I can tell you, no hospital that I've gone to in Hawaii or Wisconsin or California, that we have a person in a family that sleeps in the same room with a patient 24/7. Guam is the only place that I know of that does that. So we need to get back to our friendlier environment on Guam, Dave.
Right. And I'm glad you brought that up, Dave, because there have been horror stories that we have heard.
Yeah.
We heard from the Espinosa family just last week. He came in from Hawaii, and he has diabetes. He has so many different illnesses, but he was forced into the government quarantine facility. And as you mentioned about the man that died, the 40-year-old man, and he had also pre-existing health conditions, but at the same time, we hear about people who were granted exceptions with no sort of pre-existing health conditions.
Yeah. I mean, I don't understand how an old man, like, an old veteran like Mr. Espinosa, who just came from having open heart surgery, gets thrown into quarantine. Yet I know of a person whose father-in-law was sick and they got a pass. So it's really inconsistent. And, Dave, you also bring up a good point. Because in talking with Mr. Espinosa, what we were able to glean was that the medical presence at the quarantine facilities is sorely lacking. Where, Mr. Espinosa, I mean, he's a guy on medication, that there was like one nurse. They couldn't really get a hold of them. And I'm thinking there's other facilities. And, if we hear from public health that, they're short this, they're short that, it's making it hard to do things that they need to do to respond to the pandemic. I can only assume they're also short at these quarantine facilities. But we'll and while we're on this subject, we'll start with you, Moneka. Why do you think there hasn't really been a move to improve and kind of work through a lot of these issues that we're seeing with these quarantine facilities?
I know one of the major concerns I have too, especially for those who were away from the island for medical reasons and then come back with dietary restrictions in their rehabilitation state, and they get this food that's really not the best for their healing process. So I think that I haven't been off island since COVID, and I haven't known anyone who's had to go through these quarantine facilities since the onset of it. So how they're still able to be responsive and then as well as take care of all the people in quarantine is not something I can speak strongly on. But yeah, I think there definitely should be some feedback from people like Dr. Shieh on ways to make this more efficient and more effective.
Well,
I had a friend who came back from the States and was put into quarantine, and the experience that she had clearly indicated The hotel room was frankly shabby, wasn't cleaned, and the food service was dropped by the door in a box, probably was not warm, and the only government that checked on her was once a day a nurse came by to take the temperature. And I don't think that's the type of treatment that we should be giving our residents coming home.
Will?
Well, then again, you have, they said tourists can come in for 5 days without quarantine and no testing, right? So maybe you come back and declare yourself a tourist. I don't know, but
or maybe you
and
just
fly back out again 5 days and come back again in 5 days. Who knows? But the message is inconsistent, Dave. And I think that's what I'm trying to stress to the government is that we got to be consistent. Consistent meaning that is COVID serious? Okay, if COVID is serious, then let's take this seriously. But don't tell people, the tourists, to come on in, you can visit, it's okay. We have a public health declaration emergency. When we have that declaration emergency, let's take it seriously. Let's not say, let's open up tourism for one thing or make exceptions. And then we shouldn't say, the Center for Disease Control, you're wrong. You're putting us at a high risk level at level 3. Well, we should be low risk. But then here we are, we're trying to lock down, we're trying to mitigate all these positives, etc. So we're not out of the woods per the government. So we got to have that consistent message. Are we out of the woods per tourism? Are we out of the woods for public health emergency? If we're not, then let's take it seriously and let's not criticize CDC for putting us on level 3.
Okay, Will?
Yesterday we had the highest number of reported cases on the island. I think that's clearly a red flag.
Well, then again, those cases, are all those cases actively positive? That's the question I have. And they can't tell me that. They said, we treat all the positive the same. Well, if you treat all the positive the same, then of course you're going to count all these positives, even if you don't have any symptoms, right? Majority of the people who's positive have no symptoms. And like, again, the very governor, lieutenant governor, Dr. When they were asymptomatic, they tested negative. Only when they had symptoms, they tested positive.
Will?
So we got to ask ourselves that question.
I want to, Dr. Shieh, do you think that we should be going back into PCOR 1 or PCOR 2 or just status quo of PCOR 3?
Right.
Despite the fact that we've seen these...
Is there a PCOR 0 as an option?
How about PCOR negative 12? That's what I'm thinking.
Going back, people may hate me this, but I was the first one to suggest to the governor to lock down. And she didn't like it. I got to admit, she didn't like the lock. She didn't want to lock down. I talked to her in her office and said, you got to lock down. She didn't like it. But I think a week later, she decided to lock down.
Right.
But, I give my opinions, and I'm not perfect, and there is no perfect solution to this. But I think we have to use some common sense, okay? If we're going to lock into PCOR 1, then we need to do it seriously. No one leaves the house. But how are we going to do that? We learned from, like you said, our first lockdown. And I think the first lockdown, we did okay, but then there's still people outside. If you look at the amount of exceptions during PCOR 1, there were a lot. I think the construction workers were still exempted going out to work.
Yeah.
So if you're going to lock down, be serious about it, People don't like the National Guards out. I personally don't mind because we have a serious public health emergency.
Right,
so if you want to lock down and do a true lockdown, complete lockdown for 2 weeks, but don't list all these exceptions of all these business constructions, you're exempted, the plumbers, or everybody's exempted.
Sign company was
essential.
Yeah.
Okay.
I think
there was another...
The military didn't, behind the fence, what was going on as far as construction, without regulatory agencies being deemed
essential.
What is essential, they weren't able to do their jobs to make sure that due diligence was done to protect ancestral burial sites or to do any sort of environmental review while the military was still being able to build their construction and they never stopped.
Yeah, it's essential to bulldoze our ancestors, that to the military, it's essential.
That is not
one other thing about the government of Guam is the news has covered the fact that the Department of Corrections employees were all tested. Now we hear they're going to test the inmates there. Shouldn't they all have been tested at the same time?
Here's the thing with the testing again, right? You test today, you're negative today. Tomorrow you could be positive.
Right.
Perfect example, asymptomatic. You're testing all the asymptomatics. I tell you, it's going in circles and circles.
Asymptomatic or asymptomatic?
Asymptomatic.
I agree with Dr. Shieh that if we're going to go into a lockdown, we need to do a real lockdown.
Right. Yeah. And guys, we'll just take it there, right? So there's this discussion that people have that we just went to peak or 3, too quick. And there was, I think, our friend Nick Delgado from the Post had asked the governor in a press conference, what could we have done differently? And I said this before, I think the governor has a hard time, and we all do, in admitting the faults. And she basically had said there wasn't anything we could have done different unless there was a vaccine. That was like the only thing that would have made it, better. And so when people talk about us moving to peak or 3 too quickly, you can just assume that means they don't think we were locked down for long enough. So if we go into a lockdown for 2 weeks and, come back again, and then we're going to see another surge, it doesn't really seem like a long enough amount of time. So what do you guys think would be something more feasible if we really want to stamp out this virus? Because you're right, we don't want to go lock down 2 weeks, full freedom a month. Oh my God, another surge, lockdown 2 weeks. We look at the model of New Zealand, for example, they're going on 100 days with, no positive cases. And I think they had a pretty crazy lockdown. So lockdowns and killing this virus, what do you guys think is a good amount of time that we need to kind of hunker down?
Well, in terms of how long we got to be hunkered down, even for this preliminary lockdown we're going into, I think 2 weeks is too short. I think at minimum we should be looking at 8 weeks, and assess from there. But 2 weeks. The problem with the approach they did last time is they said 2 weeks, 2 weeks, 2 weeks. Every week it was 2 weeks, and this made people antsy. We need to start preparing people in the beginning that they need to have this mentality that we are digging in for the long term. This is not going to be a short-term lockdown, so we need to prepare for that mentally. And part of that comes with messaging. I think we need to improve the messaging of the lockdowns and prepare people for the idea that this is going to be a longer period. Because I think there's a certain amount of denial that's going on, where people really, really want this to be over and go back to normal. And I think once we've gotten over that denial, we'll come to a better place in terms of timing, because the economy's not coming back this year. It might not even come back next year. So at that point, we need to look at taking care of ourselves, and we'll worry about the economy later. Right now, we are in we are what I like to think of as like a war economy. We are being sieged by an unseen enemy. And when you are a castle that's being sieged, you don't send people to work or go to the market. No, everybody stays home behind the castle walls, and you have a centralized planning economy that makes sure everyone is taken care of for the duration of the emergency. We keep acting like this emergency is going to go away around the corner, but it's not.
Mm-hmm.
I think we also just have to look at other international places, like what Chris said with New Zealand. They did have community positive cases just this past week after 102 days of no cases. But there's other places who have been able to maintain some sort of openness, like South Korea, but they have really aggressive contact tracing methods where you have apps and you have different things. If you're in contact with somebody, it bings if that person was tested positive before. There's different measures that we could take using technology and using the example from other places who've been able to get a better grasp on it than most definitely the United States.
Mm-hmm.
I tend to agree with Will that we need a seriously long lockdown. We need no rush to get out of it. But we also need to take a look at travel to the island. Can we seriously quarantine ourselves? Now, there was a mention made of New Zealand, and I'm thinking, and maybe perhaps another person has more of a background, that they have quarantined the island. And I'm also rather certain the closest island to Guam, Rota, I think has no cases of COVID, but basically there's no travel to or from Rota.
Dr. Shieh?
Sure you want my opinion on this again? Oh man, let me tell you what I learned. Let me tell you what I learned from this whole fiasco of lockdowns and COVID testing. Okay, I've learned three things. Okay, that is maybe the most best defense that we have. Okay, Wash your hands, okay? This is a big, huge bottle of sanitizer that I carry with me everywhere I go almost, okay? So you use this, okay? Let me show you how it's done. It's very simple. Very simple, okay? Wash your hands. If you don't have any dirt in your hand, it's okay. If you have a sink, it's better to use soap and water, 20, 30 seconds. Always do that. I wash my hands about 100 times a day. The second thing is the second W, the 3 Ws, okay? You have to wear your mask, okay? This is N95, and I wear this when I go in the clinic or when I go into the hospital. When I go outside, sometimes I do still wear it, okay? One of the best protections. The third thing is social distancing. We know, hey, Dave, if you're gonna be near me, I'm gonna stay away from you, okay? You're not gonna infect me if I have all these 3 things, okay? I can tell you, you're not gonna infect me unless you cough in my face or you come and rub me or you kiss me or something like that. You don't do that. I think we've learned. I think the community have learned. So I don't know if a full lockdown is gonna work, okay? You may work for a month, 2 months, but then you get back to the community again. If we're gonna live with the virus, let's learn from Taiwan, for example. I speak Taiwanese. I was born in Taiwan, okay? They never really had a lockdown, but look at Taiwan. They did doing a very good job. And but then again, the people in Taiwan wearing masks, wash their hands, and the distance, okay? They're very good with that. So I think if we learn, if we can ask every citizen out there to make sure they practice the 3 Ws, we may not need to go to PCOR 1. Seriously, we may not need to. Mm-hmm. The second thing that we need to do, first is the 3 Ws. The second thing is that we need to do smarter testing. Smarter testing, I mean that don't just count the positives. What does the positive tell us? Okay, if you test positive, Dave, for example, Dave, when was the last time you had a cold or a cough? And you say, well, back in January. Okay, since January to August, have you had any symptoms? Okay, Dave, well, okay, maybe back in June I did have a little cough. Okay, so 60 days ago you had a cough. You went and tested today, you was positive. So I said, oh, okay, but you had no symptoms for over 60 days. Then Dave, I think you probably had a past infection and you're still testing positive. And we know that from PCR testing, you can still test for viral particles. So I will test you, Dave, for antibodies. And I've done that for several of my patients. The patient was locked up. I sent them out to the lab. The antibodies came back positive and no symptoms. They're not infectious. So we need to be smarter with our testing. We can't just say positive is positive, positive. We can't. And like I said, I told Will before, Will, get a copy of the actual lab report, not just the result positive. Read the entire paragraph and what it says below the positive. It'll tell you what that positive means or it couldn't mean. So we got to be smarter in testing. So those are the 2 things that we should do. The third thing, as far as travel goes, Dave, is that I don't think we can prevent flights from coming in because Guam is an island. We can't survive by ourselves. We need medical equipment. We need people coming in. We need essential workers. We need healthcare workers coming into the hospital and to the clinics. So I think we need to think about this. Treat all passengers coming in the same, not risk, high risk, low risk. Quarantine them at their own home, if their own residence here. I think that's better for them health-wise. And not just physical health, but mental health. I think that's very important. So those 3 things that I would recommend.
You forgot 1 W, win. There's so many people looking to win in this election. Should we still have an election?
Well, that's a good question. Let's ask you this question. Is the election essential? Okay. Is that an essential event in a life or death situation? To politicians, yes, it is. But to me, it's not. Election to me is not an essential event. It's like a concert. Is it a concert essential event? Election essential event? Certainly, there's going to be certain sectors that don't want a politician to stay in power for a certain amount of period. But if we can postpone that, if there's a public health emergency, certainly postponing election is okay with me. And that's just my opinion, because to me, an election is not an essential event.
Dave, what's your thought? To primary or not to primary?
I would think the primary is not essential, but I would think the general election is essential.
Right.
Yeah, I'm with Dave on that one. I think the primary is inessential, and the one in November is. But I do think that there is leeway for the November election to be potentially delayed. For me, my personal line is, if we delay the November election, I at least want it resolved before what would have been the inauguration date for the new class. So that the little window between November and January, I'll take a little bit of a delay, but elections, especially for America, are a significant cultural touchstone that I don't think we could ignore.
Especially in today's chaotic political atmosphere in the mainland, it's if there's already forces that are alleged to be working to subvert the election, and if that were to actually occur, I think you'd have some serious disruptions in the country.
Yeah.
Moneka?
And I mean, I don't think we could get the lockstep with it here on Guam. I mean, realistically, for any government that was in power during COVID, they're probably going to lose their seat. That's just the brass tacks of it. And so, I mean, right now we got a majority Democrats, and so I'm sure there's a lot of Republicans that would not like to see the November election canceled because they think they have a really good chance of winning. And so, and that's true for everywhere in America. Everyone is looking to get in on the next election, and we're going to have some real problems, as Dave said, if we basically deny them their equal protection and rights to an election.
Moneka?
In regards to the election, I think maybe in some village cases where there are a contentious mayoral race, then maybe in those specific instances to ward off the event of a runoff, even with the congressional election, which is really the only reason why we're having a primary election right now, is for the for that specific race. It might be an option to look into of just doing the primary in places like Jigo, or what is it? Tuan, Harmon area, where there's a lot of different people running in Narahan on one side of the ballot, but definitely the senatorial race it's not necessary. And yeah, I think the only reason why the senators wanted to have the primary and hold the primary is to save money in an inevitable runoff election between the congressional candidates.
Guys, a little something different here. I think I want to ask nationally, right? So we had, former Vice President Biden announce his running mate, and so the stage is set for the national election. I'm curious to get you guys' thoughts on that, because we don't always talk national politics, but you're starting to see it really bleed over locally, right? So when I look at my Facebook friends, I got a lot of friends locally who are chiming in on, not just the selection of Kamala Harris, but also the election in general, because this is, I mean, you think our politics is divisive. This is as divisive as it gets in the continental United States. So we'll just throw it to whoever wants to talk first. Your thoughts, the national presidential election.
Well, I don't think we have a say in Guam. I mean, we can't vote for the president. So, I mean, I really haven't thought about it. But, I just watching CNN, every time I turn on CNN, it's an anti-Trump campaign or anti-this, anti-Trump this. But, some say the politics that this COVID, come November, it's going to disappear. So I don't know what to say. But if you can ask me who I would vote for, Trump or versus Biden, I wouldn't know, because I don't know them really good enough. Trump will probably, continue in his parade at what he wants to do. Nobody can tell him what to do. Biden, on the other hand, I see the video that he's like having some dementia or something like that. So I don't know what the truth is. So if you ask me who I will vote for, I don't know. I can't answer that. But, Chris, you're a comedian. You can probably come up with something, a jingle or something about that, right?
One thing I'm really concerned about with the U.S. election, and I think this is really important for our entire island and all those in Micronesia to really pay attention to, is the U.S. Postal Service and what's happening with the mail-in ballot issue. This Trump and his administration and the person who's the post office general right now, or Matt Postmaster General, they are systematically wanting to privatize the U.S. Postal Service. And for us out here in the islands who depend on the subsidized mailing system, it's really important that we keep an eye and we keep tabs on what's happening with the Postal Service, because that's a lifeline for so many of us, especially out here so far. Where if we would have to only rely on DHL or these other or FedEx or these other private shipping companies and mailing companies, we wouldn't be able to get so many of the goods that or even our letters from our family members from the States or from elsewhere in the world. So in regards to the national election, I think that's the one issue that we really need to keep our eyes on.
Right. Dave?
Trump has put a postmaster general in charge who has financial interests in private delivery services and has taken steps to hinder the mail service. I know I have several things I'm expecting in the mail that have been significantly delayed. I'm just wondering if the other members of this panel have been experiencing the same thing.
Yeah, everybody
Dave,
does.
I think, Dave, I think in every administration, don't you think that any of their appointees have some financial interests?
Right.
Not to this extent. I share your skepticism, but I think it is so blatant. If you look at what Trump has put in as department heads, they all have an agenda that is a right-wing, big business agenda to make the government weak and look inept so that the big financial interests can benefit. If you look at the first relief package that passed Congress, an immense amount of that money went to big business interests. And now we're completely stalemated into the Congress and thinking that people that are unemployed can live on $400 a week. And then the latest news here is, well, now government of Guam has to come up with the 25%. That really puts us in an extremely unfair advantage.
Yeah. Well,
that was a Hail Mary. That was a Hail Mary executive order. That's not a real answer, because the funding that would use would be the FEMA funding, and allegedly that funding, even if we were to take part of that program, would only last about 5 weeks before it ran out of money. So I mean, in terms of a fix, it's not even really a fix.
And yeah, for us out here in Typhoon Alley, it's really important that we understand where FEMA money would go in case we have a typhoon. Wouldn't be, and that fund would be dried up for some other for COVID relief. It's really important for us, given where we are and the amount of storms that we have, and even earthquakes, the possibility of earthquakes, that we protect FEMA money for what it's meant for.
Guys, can we just close on? I wanted to, if we could just close on this whole Netflix, the hating on Micronesia thing. This is something that came down. You know, we covered it. Victorious Falon, they're dropping a One Micronesia podcast on this. It's going to be really great, guys. So, Jays, when's that scheduled?
10:30.
10:30, KUAM News on Facebook. All right. So, guys, I know we're doing the press conference at 11:30. So let's settle in and watch the One Micronesia podcast, where we kind of go in on this whole Netflix Micronesia thing. And Moneka, we'll start with you and then just go around. Your thoughts on it.
Oh, I definitely have been doing so much more work, especially as a Chamorro ally to all of, and also a Micronesian, wanting to do all this unification work within the Marianas and the wider Micronesian region, and especially in the face of climate change, and wanting to ensure that our whole region is resilient and ready for the impacts of this environmental shift that we're going through. So when something like this happens, and you see across social media all this response in unity, especially from people that I would never have expected to come out and speak out against this really problematic scripting and show on Netflix that degrades our whole region, especially the Federated States of Micronesia, by calling us the country terrible. It was just really I like to see the backlash that's coming out from our community, and the unity that's coming from that. So in a sense, it sucks that Netflix put us out like that, but I'm appreciating the ways that we're coming together to combat that.
Will?
Yeah, this is kind of for me, like I get it, it's problematic, but this is an old media trick that they do, where they will poke fun or make some sort of controversial statement about a very passionate group of people in an effort to gin up engagement with their product. So a common example, because this personally happens to me a lot, is whenever like late night talk shows talk a lot of crap about like video gamers. I'm a gamer, you know? And they do that not because they actually have anything against gamers, but they know the gamers will go on there and vociferously defend their hobby in the comment section and boost engagement with their product. It's the same system here. They know that the Micronesian people are very passionate. Like some people, somewhere in that map, they know, and they're taking shots because they're trying to gin up conversation, engagement with their product. And so, I mean, like, I don't really want to engage. It's bait. It's bait, and it's much ado about nothing, I feel.
That's Shieh.
You know, I haven't seen the clip, but you know, I think I'm very sensitive to the people of Micronesia. I think if the segment was badly put in place, I think perhaps the producer or the director can perhaps reach out to the people of Micronesia and just say, hey, you know, like what Will say, hey, you know, this is just a show, it's entertainment, and maybe we did in a bad taste, we apologize, but we did not mean to be that way. I think if they issue something like that, I think the people of Micronesia may understand that this is entertainment.
Right. Dave?
I tend to think it's just frankly wrong to talk in negative terms about any ethnic group, and this should not be allowed. And unfortunately, we see too much in this country.
Well, you know, Dave, this is the United States of America. We fought. Were you in the military?
I was in the United States Navy.
And so was I, right?
My point is, there should be no place in the United States where we talk negatively about another religious or ethnic or sexual orientation group. And unfortunately, that's
I agree. I agree with, I agree with that. But the other part, in addition to the movies, and we see comedians do it all the time. You sit in front of a comedian. Oh my God, I would never want to sit in front of front row of a comedian. They'll chew me out, you know, about my race. So we have to take it with a grain of salt, like what Will had mentioned. But I think Monique is more sensitive to the Micronesian culture. So I think we need to be sensitive to that as well.
Right, guys?
Yeah, I think also just given that like in the clip, it was the U.S. against Micronesia, and just given the egregious crimes against humanity that the United States of America has against has and continuously does put upon our people in Micronesia, such as the nuclear testing and such as more land grabs for the military here on our islands and in the islands in the Northern Marianas. It's really, it was in poor taste. And it was meant to be light humored, but there's so much heaviness that goes between the relationships of our region and the United States, and it was just poorly crafted on the part of the script writers.
Guys, I got to thank you so much for your input. Bree, what were your thoughts on this Netflix Micronesia thing?
I just think they're just ignorant. They don't know who we are.
Right.
But I agree with Moneka. Like, we can turn this into a positive and spread more awareness, and it's brought everyone together. So.
Right on. Well, as a comedian who's made fun of every ethnic group on this island, and you know, 1,000% of the time, I was encouraged by people in those very ethnic groups to keep on going. Let me tell you a funny story, because when I went to Saipan a couple years ago, there was a senator there who really tried to call me out about some jokes I had made about. It was something with Chookies, and it was funny because I'd done, you know, growing up, observational humor, and you're right, it's a crazy time to be a comedian, which is partly why I'm glad I'm doing this, but, you know, I was doing jokes about what I knew, right? And so I knew Filipinos, I knew, you know, Chookies, we all do. But what I thought was cool was I really tried to just keep it, you know, on the Chamorro side because that was my upbringing, but I would run into my friends who were Chookies, and they would be like, Chris, man, can you do more of the Chookies joke? And I was like, are you kidding? Everyone's going to get mad at me. They're like, no, do it. And I did them. People loved them. And so I just, I think I'm more on Will with this, though. You know, being 45 years old, I've seen Netflix Micronesia type things my whole life. I just don't have the stamina to get, you know, super outraged about it every single time because it's just not sustainable. And I just am never surprised by what, you know, the continental U.S. manages to cook up, not just about, you know, Micronesians, but about Guam and just about everywhere. I mean, we could go back to the S-hole countries thing. So I'm just never surprised by any of it. And guys, thank you. This has been a really great hour of conversation.
Yes,
Really,
thanks so much for joining us today.
and I really think this is necessary for us to get together and break bread in this way as we head off into uncertainty.
And real quickly, a real quick poll before we head out. Just yes or no, is this virus a B? Will?
Is this virus what?
A B.
Is this virus a bitch?
Yes or no?
Oh, big B.
Big B.
Big B.
Moneka.
Yeah, it's a bitch.
Dave.
Yes, and it's a major challenge, a unique challenge.
Okay, and Dr. Shieh.
I have no comment on that B word. I think we need to get out of the. We need to get out of this spin, okay?
Yeah.
We got to get out of the spin. We can't just keep testing and testing. You know, if you're gonna keep testing, my cartoon, my Facebook, and it's popping up.
And we get the $2,000 a month.
Right,
that
okay,
they're
guys.
promising, we could do a good lockdown.
Hey, we don't have
And
time
if
for an
everyone has
after
to
party.
But
Thanks
Chris,
a lot.
I tell you what, though, you got me interested in Netflix. I'm gonna go and look it up now.
Right,
See, Will,
yeah.
see what you did.
There you go.
I
You're
also
promoting it.
recommend The Naked Director. Great show.
Okay, guys.
All right.
Thanks.
Thank you. Be safe.
Wash your hands.
All right.
Okay. Do the M's, the W's actually.
Yeah. So 11:30, the press conference is going to be streaming live.